In this episode of the Golden Careers Champions docu-series, I speak to Bianca Darbey, who is a social worker here in the UK, about the implications of the coronavirus on her work and life, as social workers are warned to prepare for longer home care visits and extra administration. This will raise social work-related queries. To tell us more about her life and work during these challenges is Bianca herself.
It has changed dramatically, Kevin. If you can imagine, in a way, it's been a bit of a change of family dynamics as well, because, like, I'm working from my home. My youngest daughter is also working from home. In a way, it's working as a positive to the young people who are so familiar with the social media. They can manage to type on the computer as well as listening to music. I don't know how they do it.
Now, you mentioned earlier that this whole pandemic has made your own life change dramatically.
It has changed a lot at work in terms of time scale, self-discipline, and in terms of making sure that I get on with the work while I'm also practicing high levels of hygiene. For example, after touching the laptop, to wash my hands, make sure that my hands are clean. It doesn't necessarily mean that because you're working from home, you can just stop working and attend to your home issues. You know what I mean?
You've just preempted my next question. Earlier, you gave me some tips that you'd like to sort of give out to our audience about the best way to work from home.
So you pretend like you're going to the office when you're coming to your workstation, the part of the room that you use as the office. You have to prepare it, get yourself set, your alarm, and you wear your nice clothes, dress the way you always dress when you're going to work, so you can be in the best mood to start working. Otherwise, you might find yourself back in bed. You know what I mean? You have to structure your day like how it is in the office.
Right.
But the thing is, when you're working from home, you're your own personal manager. There isn't that kind of face-to-face interaction. In a way, it gives you more time to focus and to have confidence in working on your own.
And you stay on schedule.
And you stay on schedule because there isn't time for chatting or asking for a pen from a colleague or answering the phone on behalf of your colleague who has left the desk.
Oh, Bianca, these are gold dust, these tips. What's the next one?
I'm not bothered about what's going on outside, although I make sure I have some bit of sunlight getting into the room or into my workstation to say.
So it kind of puts you in the right frame of mind.
It does, and it feels healthier to get some bit of fresh air while you're working. I've limited myself to only the sites that I use for work purposes. I'm not into my social media at that time. If I need to email, it's to email my manager or my colleagues if I'm struggling to do something. So the only time I use social media is to communicate with either my manager or my colleague. So I find it disciplines me in a way. I remove all of unnecessary social media from my toolbar so that whatever I have is important tools that I work for my work, you know.
Now, social worker, when are you at your most productive? Does that matter?
You have to devise a system. When you want to do your hardest task, you may as well save for those when you are in the best mood to tackle those kind of tasks.
Do you then take a break even though you're working at home?
Oh, yes, Kevin. I do take a break, as you may as well know. Being on the computer for long periods and long hours is not healthy for your eyes, for your concentration, for your back. So I do take the necessary breaks that I would normally take in the office.
You're kind of active in your community. You know, you keep in touch with your compatriots and the migrant community here in the UK. You're originally Zimbabwean. Your WhatsApp group mentioned that the coming 2 weeks are the most crucial?
An NHS worker friend of mine, who's also my neighbor, suggests that as of tomorrow, do not leave home for bread, for anything, because the worst begins tomorrow as the incubation date is met and many people that are positive with the virus start to peak. It's at this time that other people that are more vulnerable, it is very important to stay at home and not to be in contact with anybody, even members of your family. Being very careful is very important and very crucial at this time. So you understand, Kevin, that this is a crucial time where this disease is at its peak.
Yeah, I read somewhere as well that after the peak, there will be 2 weeks of calm and the 2 weeks where hopefully it decreases.
It will not manifest in bigger numbers. Now that the people are aware of the trend of this disease, learning from other countries.
After all these years and years of social work, what currently is your speciality?
Well, after all these years of social work, Kevin, my specialty has always been in safeguarding children. And that means safeguarding and protecting them from any form of harm. The child is paramount in any plans that I make.
How has your work been impacted by COVID-19, by coronavirus, the work that you do with safeguarding?
It has been impacted a lot in the sense that it's the first time that we've all experienced this kind of a pandemic. So because of the fear or the anxiety that this disease has caused to people, it has kind of made it difficult to have that face-to-face interaction. Well, the guidelines are that we need to safeguard ourselves and save lives at the same time.
So it's basically child advocates as well, such as yourself, who've had to adopt from to a kind of social work from a social distance.
Well, it's changing. Social work is changing now from like 10 years ago where we used to have paper files. Now with the new system, everything is in the computer. So we don't have those piles and piles of paperwork. We do have a lot of work on the system. We have measures and ways keeping information safe through the Data Protection Act. It's an interesting time, and it has kind of opened our minds to look at other options of working. Because, as I said, safeguarding is very intrusive and can be confrontational. But if you give people their space and time to reflect on their own actions by monitoring through video calls and what we're using now, I think it's another form of working.
What would your advice be to people in your same profession in the motherland?
Well, social work really is to be an advocate for the poor, for the vulnerable. The same principle applies to our colleagues in Zimbabwe. I would urge them to continue doing the best for the vulnerable communities, using the limited resources that they have. And I'm aware that in Zimbabwe, we used to do what we call developmental social work because there wasn't much of child protection as in first world countries. Although times have changed now, we've seen a lot of rise in child protection and safeguarding issues in Zimbabwe as well. But I would urge them to continue doing the good work and empowering people to look after their families, their elderly, their disabled, and their young ones in the same way that social work in Zimbabwe empowers people through developmental social work.
Do you feel the experience of, countries such as ours to kind of help push back this virus and fight it should be giving hope and courage to Africa as the virus increases its presence there?
The world, through communication, using social media as such, has become one village. So there is need for people to spread the word about the risk associated to these gatherings be it musical shows, be it parties. This is not the time to be doing that. So I would suggest that people continue trying to conscientize the back home about the need to stay indoors, to go and be at home, unless there's the necessary and urgent need to go out to buy food or medicine or something like that. But I would really urge people that we don't need these gatherings or these social interventions that are going on back in Zimbabwe or in South Africa. I heard that Zimbabwe is already on lockdown. I think research does show that by minimizing the spreading of the infection, we hope one day to finally eliminate or eradicate this disease.